Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today, we talk about something almost everyone has felt: headache. Most people say it's just a headache, but sometimes that just a headache is actually your brain sending a warning sign. The big question today is simple. When is a headache just normal, and when is it a danger sign you must not ignore?
Exactly. Most headaches are not dangerous, but some headaches are red flags for serious brain problems. In this episode, we will explain, in clear and simple language, how to tell the difference and what you should do.
Let's start very basic. Doctor, in simple words, what is a headache?
A headache is pain in your head or face. The pain comes from the blood vessels, muscles, or nerves around the brain and skull. The brain itself cannot feel pain, but the structures around it can. Headache can be mild and annoying or sudden and severe. The important job is to know which type you are dealing with.
We hear different names: tension headache, migraine, sinus headache. Can you explain the common types in easy language?
Sure, let's keep it simple. First, tension type headache. This is the most common type. It feels like a tight band around the head or pressure on both sides. It is usually mild to moderate. It is often linked to stress, poor sleep, long screen time, or tense neck muscles. Second, migraine. Migraine is usually a throbbing or pulsing pain, often on one side of the head. It can come with nausea, vomiting, and sensitivity to light and sound. Some people see flashing lights or zigzag lines before the headache. We call this an aura. Third, sinus-related headache. This is pain in the face, cheeks, or around the eyes. It often comes with a blocked nose, runny nose, or fever. It can get worse when you bend forward. Most of these are called primary headaches. That means the headache itself is the main problem, not a sign of another disease.
So those sound uncomfortable but not always dangerous. When should we worry that a headache is actually a warning sign?
Great question. We worry about secondary headaches. These are headaches caused by another serious problem, like bleeding, infection, high pressure inside the skull, a brain mass, or certain parasites in the brain, such as Neurocysticercosis. Think of these red flag signs. First, a sudden, very severe headache. People describe it as the worst headache of my life. It reaches maximum strength in seconds to minutes. We worry about bleeding in the brain, such as a subarachnoid hemorrhage. Second, a headache with fever, neck stiffness, or confusion. This could be meningitis or another brain infection. It is especially serious if the person is drowsy, confused, or has a strange rash. Third, a headache with weakness, numbness, trouble speaking, vision changes, or a seizure. This could be a stroke or another serious brain problem. Any sudden change in vision, speech, or movement is a medical emergency. Fourth, a headache after a head injury, for example, after a fall, a traffic accident, or a strong hit on the head. It is especially worrying if there is vomiting, confusion, or loss of consciousness. Fifth, a new or worsening headache in people with cancer or low immunity. This could be a tumor, an infection, or another serious condition. Sixth, a headache that is getting worse day by day. We worry even more if it wakes you at night or is worse when you lie flat, puff, or strain. That suggests increased pressure inside the skull. Seventh, in older adults, a new headache for the first time after age 50 should also be checked carefully. In some parts of the world, another important cause of secondary headache is a parasite infection in the brain called Neurocysticercosis. It comes from eating food contaminated with tapeworm eggs, often from undercooked pork or from poor hand hygiene. Many people do not know they have it until they develop headaches or seizures, and doctors find small cysts in the brain on CT or MRI. If any of these red flags are present, it is not a wait-and-see situation. It is a go-to-the-hospital-now situation.
That's very clear. Before we move on, can you give one quick example just to make it real?
Yes. Imagine a person who suddenly gets the worst headache of their life while sitting at home. They think, maybe I'm just stressed, and they lie down instead of going to the hospital. By the time they finally come to the emergency department, they have bleeding in the brain and are much sicker than if they had come early. We see this type of story in hospitals all around the world. That's why we keep saying, respect the red flags.
That really shows the danger. Can you repeat once more in very short lines when to go to the ER immediately?
Go to the emergency department immediately if you have a sudden, very severe headache. Go if you have a headache with weakness, numbness, vision loss, trouble speaking, or a seizure. Go if you have a headache with fever, neck stiffness, confusion, or a strange rash. Go if you have a headache after a big head injury. Go if you have a headache that feels very different from your usual headaches. When in doubt, it is safer to be checked. Headaches that come again and again, or headaches with seizures, vision changes, or personality changes can be caused by serious problems like tumors, bleeding, infections, or parasites in the brain, including neurocysticercosis in some regions. These are never just stress headaches.
Okay, let's say the patient arrives at the emergency room with a headache. What usually happens in the hospital?
In the emergency department, doctors move step by step. First, they take a quick history. They ask when the headache started. They ask how fast it became strong. They ask about trauma, fever, weakness, vomiting, seizures, or other symptoms. Second, they do a physical and neurologic exam. They check consciousness, speech, vision, strength, reflexes, neck stiffness, and vital signs. Third, they choose the right tests. They may do a CT scan of the brain for sudden severe headache or after trauma. Sometimes they do an MRI if they need more detail. They may do blood tests for infection, inflammation, or other causes. In some situations, they may do a lumbar puncture, also known as a spinal tap, to check for bleeding or infection around the brain. The goal is to rule out dangerous causes quickly. One example of a serious but treatable cause is neurocysticercosis. On a CT scan or MRI, doctors may see small cysts or calcified spots in the brain. Treatment usually includes medicines to control seizures if they happen. Doctors may use medicines to reduce brain swelling when needed. In selected cases, they add special anti-parasitic medicines, but only under close supervision because killing the parasite too quickly can increase inflammation. This is not something to treat at home. Management must be guided by a neurologist or infectious disease specialist, following local and international guidelines.
What about treatment in general? How is headache treated at home, and how is it treated in the hospital?
It depends on the cause. For simple tension-type headaches or mild migraines without red flags, home care can help. You can rest in a quiet, dark room. You can drink water and avoid dehydration. You can use simple pain relievers that are recommended by your doctor and are safe in your country. You can stretch your neck and shoulders. You can keep regular sleep and meal times. In the hospital, treatment can be more advanced. Doctors may give IV fluids if you are dehydrated. They may use specific medicines for migraine, for nausea, or for stronger pain. They treat the cause. For example, antibiotics for infections, surgery or special procedures for bleeding or tumors, and careful blood pressure control if it is dangerously high. Other specialist treatments are added as needed. One important message is this: do not take painkillers every day for long periods without supervision. This can cause medication overuse headache, where the medicine itself keeps the headache going.
This is very helpful. Many people worry and say, I always have headache. Is this a tumor? Can you talk about common complications or long-term impact?
Most long-term headaches are not tumors, but they can still affect quality of life. People may have difficulty working or studying. They may sleep poorly. They may feel anxiety and fear. They may start to overuse pain medicines.
The good news is that with the correct diagnosis, many headaches can be managed. We can use lifestyle changes, correct use of medications, and sometimes preventative medicines. We can use stress management, physiotherapy, or relaxation techniques. Serious causes like bleeding, tumors, or infections can lead to stroke, permanent damage, or death if they are ignored. That is why understanding the red flags is so important.
Let's talk about prevention. What can people do in daily life to reduce the risk of headache?
Here are some simple prevention tips. Keep a regular sleep schedule, drink enough water during the day, take breaks from phones and computers to rest your eyes and neck. Avoid staying a long time with your neck bent, stretch your neck and shoulders. Notice if certain foods, drinks, or caffeine trigger your headaches, and try to avoid your own triggers. Use stress management techniques like deep breathing, light exercise, talking to someone you trust, or relaxation practices. Use painkillers only when needed, not every day, unless your doctor tells you to. In regions where tapeworm infection is common, preventing neurocysticercosis also means cooking pork thoroughly, washing hands before eating or cooking, and improving food hygiene in the community. And for serious causes like high blood pressure, diabetes, or chronic infections, work with your health team to control those conditions. That also reduces the risk of stroke and dangerous secondary headaches.
Before we finish, can you give clear do and don't points if someone has a headache?
Yes, here are the do points. Do watch for red flag signs. Do go to the nearest emergency department if you have a sudden severe headache or any weakness, confusion, seizures, or vision changes. Do keep a simple headache diary if you get frequent headaches. Write down the time, possible triggers, and any medicines you used. Do follow your doctor's advice about tests, treatment, and follow-up. And here are the don't points. Don't ignore a new, very severe, or very different headache. Don't drive yourself if you feel unsafe. Ask for help or call emergency services. Don't overuse pain medication every day without medical advice. Don't try to self-treat serious headache with herbal or unknown pills instead of seeing a doctor.
Thank you, doctor. Before we finish, can you give one final simple message for today's headache episode?
Sure. Most headaches are not dangerous, and many can be improved with simple changes and the right treatment. But some headaches are your brain's alarm bell. They are telling you that something serious may be happening inside your head. Take that alarm seriously. Learn the red flags. Listen to your body. If something feels very wrong, do not wait. Get medical help early. It is always better to be checked and be safe than to wait and regret.
Thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. If this headache episode helped you understand when a headache is harmless and when it is a real danger sign, please like, share, and subscribe for more trusted health education. Share this video with someone who often says it's just a headache, so they also learn the warning signs. And remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.